Welcome, everybody, to the Smooth Brain Society. Today, we will be talking to Dr. Calum Hartley, who is a senior lecturer at the Department of Psychology at Lancaster University. His main focus are on the communication and social cognition in autistic children and adults. So, by that, you would have realized this podcast is going to be talking in general about autism. And for people who are new to the show, the way it works is there's me, there's our guest, our wrinkly brained expert, Callum, and we also have a co host to help us along on this journey who has no real idea of what our expert Callum does. And for that, we have Neil Morrison in. I'll let Neil sort of introduce himself very quickly.
Sure, I'm Neil Morrison, and I work at Lancaster University as well, but not as a researcher. I work as public engagement officer, so I take all the wrinkly brains and hopefully smooth them out a little bit so we can go and talk about people like Callum's research to the general public here.
Awesome. And yeah, of course, welcome Callum onto the Smooth Brain Society.
Thank you. Pleasure to be here. Cheers for the invite.
Yes. All right. So let's start from the beginning in the sense I said we'll be speaking about autism or autistic children and adults. So for our listeners, for our few viewers on YouTube, could you please give us an insight into what autism is?
Yeah. So autism is a neurodevelopmental condition that a person is born with. So by neurodevelopmental, it means that it originates in the brain, and it's not like there are any specific genes that we know determine autism. There are lots of genes associated with autism, and it's a condition that's characterized by differences in social understanding, social interaction, and communication, as well as some differences in behavior and also interests as well. And these are characteristics that will be present for an individual throughout their lifetime, but they can change as well over the course of their lifetime as well.
So can I ask something then, Callum? Because when I think of autism as someone who knows nothing about it, I often hear the autistic spectrum, and you also hear people talk about, oh, well, everyone's on the spectrum somewhere. So clearly it's not progressive, isn't the word, is it? But a disease with different effects at different things. I've always wondered, where does the spectrum start? Is there like a definition point?
Yeah. So one point of contention you just mentioned
Excellent.
is you referred to it as a disease, and that's quite an old-fashioned way of thinking about autism. It's considered as a difference that can vary in its impact on a person, and the spectrum component of it is really, really key, right? Autistic individuals are truly unique. And whilst we know that there are certain characteristics that are common across individuals who are autistic, the presence and the intensity with which those characteristics manifest themselves can really vary a great deal. So the way in which autism is assessed and identified is that, well, essentially we have lists of criterial behavior that are known to be associated with autism, but not everyone who is autistic checks all the same boxes in terms of the presentation of those behaviors. So this results in a lot of variability across the autism spectrum. So as I said, there's differences in the presence, what kinds of behaviors and cognitive characteristics are present, and also their intensity. So there are some folks who are autistic who their cognition, so their nonverbal intelligence, their language abilities develop very much in line with their chronological age. And so they don't have any intellectual disabilities or anything like that. But there are other folks at the other end of the spectrum who do and can have really quite profound intellectual difficulties, can have really profound language learning difficulties. So some folks who are autistic won't speak or are minimally speaking, and also engage in very different kinds of behaviors as well.
Okay, so from that, I'm getting sort of that the autism spectrum is more about a spectrum of sort of symptoms you see as opposed to everyone's on the spectrum, kind of thing.
That's right. And to be honest, that idea that everyone is on the spectrum isn't a helpful
Mm.
idea, I think. Many of the characteristics that you see in autism are or can be present in neurotypical individuals who aren't autistic, but the way in which they manifest themselves often has a more challenging impact on the life of a person who is autistic, whereas they're not so much of an issue for someone who is neurotypical. And a good way of thinking about autism these days is like in my lectures, I show color wheels, right? So you've got all the spokes represent different kinds of characteristics that we know to be associated with autism. Um, and they can differ in terms of whether those spokes light up and how much they light up, indicating the intensity of those characteristics. And also on that slide, I show two different versions of the color wheel with different spokes and different lights and different intensities. And they both represent autistic individuals, but they just differ in terms of their experiences of autism and their particular unique set of characteristics.
So I guess, or in the introduction, I sort of, and you also alluded to language as a characteristic. What are sort of the other ones?
Yeah, so when we are assessing autism, it's funny actually. Language learning difficulties are a really common characteristic of autism, but these days they're not actually a diagnostic criterion. They are one of the things that parents identify and or makes parents seek a diagnosis or an assessment for their child, but they're not inherent to autism, right? There are lots of autistic individuals who have really fantastic language skills, are hyperfluent, and yeah, really great communication. The core areas for assessment are differences in social interaction. So these sorts of behaviors might relate to eye contact, for example. So often autistic individuals will not make as much eye contact in communication. Sometimes it can be anxiety inducing for autistic individuals to gaze. Although that being said, there are social strategies sometimes that autistic individuals implement. It might be that they can overcompensate and might sometimes make more
Mm.
eye contact than you would expect. But there's differences as well in for some autistic individuals, sensitivity and desire to engage in social interactions. So early on in life, sometimes children just they don't seem as keen to socialize as their neurotypical peers, and they don't seem to be getting the same reward out of social interactions and social feedback. Sometimes kids might not respond to their name, and this can lead parents to potentially think that their child is deaf. And this is because the child just isn't spontaneously orientating towards social stimuli in the same way. Um, Differences in what we call joint attention. So, joint attention is shared attention. So, if I point towards something in the environment and you direct your attention to that, and I'm looking at that, and we're having this shared experience or of kind of sensory input. Autistic individuals make fewer bids for joint attention. They often won't try to manipulate a caregiver's attention in the same way, or they're also less receptive to joint attention. So they would be less likely to follow other people's bids. And also, you have restricted and repetitive behaviors and interests. That's the other core domain when it comes to assessing autism. And this often presents itself as, or it can present itself in lots of different ways. You've got repetitive behavioral movements. So sometimes that will be in the physical character, like physical movements of an individual. Sometimes you see sometimes there's like moving of the hands, and this can serve different functions. It can be soothing. It can help reduce anxiety. Um, as well as generating a sort of a sensory stimulation that might actually be providing some kind of positive reinforcement for the individual. You've got an adherence to often routine and liking predictable sort of routines to follow, and understanding how to structure the day, and really understanding if I perform this action, I know what's going to happen next, and being able to predict, essentially, yeah, predict what's going on and what's going to happen next. And also, you have special interests. So most autistic individuals have a topic that is really, really, really fascinating for them, and these can be hugely diverse. And often the individual's sort of knowledge and enthusiasm for this area or this particular topic might exceed their knowledge and understanding of other things more generally. So thinking about some of the children that I used to work with who did have really quite profound language learning difficulties, they might have had exceptional knowledge in this one area that will be far greater in depth than sort of general educational level.
Interesting. So, did you say it was entirely genetic, Callum, or is there an environmental factor behind it as well? Because I'm guessing it's the parents who presumably notice if they think it's he or she is autistic. I guess two, 3-ish, somewhere around there, when they probably begin to talk. But is there then an environmental impact of where the child is and that changes autism, or is it purely genetic?
So it's a genetic condition. We know that because there is a heritable component of it. So we know that if in a family, a newborn infant has an older sibling who is already known to be autistic, or if parents are autistic, there's an increased likelihood of that infant themselves being identified as autistic. There isn't any evidence for the way, like, parenting practices or the way environments in which a child is raised. None of that reliably predicts the onset or assessment or identification of autism. So it is very much a genetic condition. We just
don't know the gene.
I think, yeah, we just don't know the gene. And because of the variability within the population, it's probably that it's really polygenetic.
Yeah.
There's lots of interactions between different genes. And this results in the variability in cognition and behavior and so on. There are certain prenatal factors, like environmental factors, that we know to increase the likelihood of autism occurring. So maternal age, for example. And I read a paper recently that talked about certain conditions during pregnancy. So if there's a threatened miscarriage, for example, that's associated with increased likelihood of the infant being autistic.
I vaguely remember reading this for a completely different study, but certain things about famine and all during pregnancy as well, sort of relating to higher risks of mental health disorders and autism. I was reading it for something else, but I vaguely remember this. Is this also very
Yeah.
possible to the
So I
same
think
extent?
that feeds into the idea that maybe prenatal environment could have an influence, and it might be that those kinds of prenatal factors might well be sort of triggering epigenetic type relationships and effects that are going on potentially.
Oh. Question: you're telling me vaccines don't cause autism?
Um, I'm absolutely telling you that vaccines don't cause autism.
uh, okay, cool. Neil mentioned, and this was very interesting how you said like parents are the ones who first sort of detected around the age of 2, 3. How hard is it to actually differentiate autism at that stage with sort of other behavioral and personality like disorders which we see?
Yeah, that's a great question. And it really varies between individuals, right? Um, and just generally, that age of development is really varied anyway, right? Kids behave one way at a certain age, the next year they might behave differently. And they also vary in terms of just general developmental trajectories for language, right? Sometimes you see kids that you classify as late talkers, And you might think, okay, maybe this is a child that is maybe at risk of developing like developmental language disorder, but a year or two later, they're speaking and they've caught up. You do see that a bit. Now, when it comes to autism, it does vary quite substantially. Because if for individuals where there are really obvious markers, really obvious, aversion to social interactions, or um, really strong repetitive behaviors, profound difficulties in language, and intellectual difficulties as well, then those cases are typically easier to identify than if the person or the individual they have great language skills, their nonverbal cognition is what you'd expect based on their chronological age, and for those individuals that haven't got the co-occurring language impairments and intellectual difficulties, they typically get identified as autistic way later in life. Because the sort of cognitive issues make it more salient, more obvious, and you see this. So I work with quite a lot of autistic university students, and almost, well, yeah, invariably they say, "Well, I was identified as autistic after the age of 12, let's say, or sometimes even back end of high school, maybe even when they early days in terms of getting to university." Because they're able to kind of compensate for the characteristics of autism through excellent language skills, through developing compensatory strategies. And also there's a behavior called masking, or in the literature it's called social camouflaging, where an autistic individual might purposefully, it can be conscious or unconscious, but that the outcome is that they suppress their autistic traits and actively present in a way to appear neurotypical. And you see this more often in the folks who've got really great language skills, because it facilitates those kinds of those compensatory strategies. And it's only when a person's environment changes. So it might be that through when they've been living at home and they've had loads of support, those compensatory strategies were effective in helping them get through the demands of education and socializing and all that. But when that changes, they have to live away from home for the first time. There's huge changes in routine and environment. Sometimes those compensatory strategies are no longer effective, and this can lead to the autistic behaviors and aspects of cognition being more problematic, and this results in the assessment.
I guess that flips what Neo had asked about the environment and sort of the environmental component of it being like when you're in an environment which sort of allows you to mask these things, you're doing a lot better than the environment completely changes. And then, yeah.
When do the children first learn to mask? Because that feels like it'd be quite an adult skill, or something that would take a little while, greater just general sort of cognitive ability to be able to pull off, really.
Yeah, and of course it does require it requires those language skills. It requires the ability to imitate and that sort of social awareness. Um, I'm not entirely sure about the evidence regarding the earliest signs at which it emerges, but it must be quite early because it contributes to these late diagnoses. And also, we know that social masking varies across genders. So we know that autistic females are more likely to engage in masking, and that then feeds in to delays, in particularly for autistic females actually being assessed and diagnosed. So one of the characteristics about autism that's sort of a common stereotype is it's largely considered to be a male disorder, and the gender ratio you often hear is 4-1, as in 4 boys for every 1 girl, when in reality it might be 2-1, or it may be even more balanced than that. But it's down to the fact that we're just not very good at detecting autism in females, knowing how it manifests, and often partly what contributes to that is the presence of social camouflaging in females.
That's incredibly interesting. Sorry, go on.
Is that general, in neurotypical individuals as well, Callum? Are females generally better at social masking than males?
I mean, that would sort of be the stereotype, wouldn't it? That girls are a bit more socially attuned
Yeah,
and boys are just active play and I'm going to, play football and rough and tumble and all of that stuff. And of course, some of those norms, those social stereotypes and norms likely influence this kind of issue around assessment. So if autistic girls are able to socially camouflage and present themselves in a way that neurotypical girls are behaving, then yeah, then maybe they might feel that increased pressure to behave in a certain
yeah.
way in order to fit in, and then that incentivizes masking.
Uh, no, I was just saying when you were talking about the imitative behavior, this is where I get to flex other people who are on the podcast. So, a few episodes ago, we had a child development researcher on, Frankie Fong, who was talking about how imitation in kids across cultures, you see a lot of it around the age of 1.5 years, 2 years. So, and I'm guessing he was talking about just neurotypical imitation. So there's no necessary reason that imitation should start later, I guess, in autism, if you
Well,
haven't
it,
mentioned.
it can do in autistic individuals for sure. Yeah, just generally differences in sort of in intentional behavior can vary. So neurotypical infants often imitate what they perceive to be intentional behavior in what they see in others, um, whereas autistic individuals sometimes differ in that regard, less likely to imitate what they see in others. Yeah, I would say, yeah, that's a difference that you do sometimes see.
And what's the average age of diagnosis? Because you said it was quite delayed.
Well, usually it is in early-ish childhood. So for cases where it's quite or relatively obvious, you might see it between 3 and 5, but it varies depending on. There's a bit of a postcode lottery component to
Right.
it. Assessment services vary in terms of the backlog,
Yeah.
basically, and this can result in individuals who are quite clearly autistic being delayed in receiving that diagnosis. And that can actually be really quite negative for that individual because the earlier that they are identified as autistic, the earlier they can start receiving the support that they need, whether that be financial or appropriate educational interventions. And we know that earlier, the earlier you can start receiving optimal support, the better outcomes are likely to be, particularly for individuals who have language learning difficulties or intellectual difficulties. Early you start receiving support, the better things usually go later on. But as I said, because autism is a developmental condition, by its very definition, we know that it is present from childhood in every case. And there are some research studies that record kids' first birthday parties. And there's some evidence from those that suggest that you can differentiate autistic individuals based on their nonverbal pre-linguistic behavior as early as one
Wow.
from these
Wow.
first birthday recordings. But that's not the case for every individual because, as I say, some folks only get receive the diagnosis much later on in life.
So with all the heterogeneity around autism, how do you go about even sort of studying it? Like, yeah, how would that sort of work?
Yeah, so oftentimes, certainly the majority, I do quite a lot of diverse research these days, but one of my sort of primary areas of research is studying language development, particularly acquisition of vocabulary. Excuse me, in autistic kids that do struggle to learn language. So what we do is we work collaboratively with specialist schools, and some specialist schools cater specifically for autistic kids. They're often the ones that we work with. So all of our participants, if we go to a specialist school, we can recruit children who already have received their assessments, and we do try to work with groups that have some consistency. So for my work with word learning, vocabulary acquisition, we work with kids who we know have those delays in language development and trying to understand some of the factors that are contributing to those and try to identify how the environment can be altered to better support vocabulary development. But equally, I do lots of studies with adults at university as well. So, and they, whilst they share the same diagnostic label, autism spectrum disorder, obviously their profiles are very, very different. You've got these kids at school who might often be really struggling to speak. They might not speak at all. Whereas you have at university, you've got these exceptionally intellectually developed individuals who are studying maths, astrophysics, all sorts, right?
Does that make doing the experiments difficult, Callum? If you've got such a range of subjects, it must be very hard to. I mean, I'm a biologist, right? So a rat is a rat, a Wistar rat is a Wistar rat. They're all going to behave the same way, whatever you do to them. But it sounds like your experimental group is going to be a wide-ranging one.
That's absolutely the case, but we address different questions that are pertinent for different groups of people. So the stuff in schools with kids that are minimally verbal or non-speaking, we're looking at the very basic mechanics of acquiring vocabulary. So how do these children identify the meanings of new words that they hear? How do they retain the meanings? How do they generalize them? Whereas some of the studies we work with autistic university students, we're looking at different kinds of issues that are more relevant to them. So, for example, one of the programs of research that I'm working on at the moment is examining what deceptive communication looks like in autistic adults. So, an issue that autistic individuals experience in the criminal justice system is that they're increasingly likely to be perceived as deceptive because there are lots of stereotypical cues to deception that are just natural behaviors in autism. So aversion to eye gaze being one, for example, right? There's a stereotypical idea that if you don't don't look at someone's eyes, there's a chance that you're telling a fib, right? And deception detection strategies that are used in forensic settings are informed by neurotypical norms about behavior. So autistic folks are often misunderstood and at risk. I've worked with a fantastic PhD student, Tegan Blackhurst, who also we're collaborating with Autistica on this project, which is the UK's leading autism research charity. She is conducting a series of studies that are profiling basically what differences in truthful and deceptive communication in autistic adults, differences in the qualities, both nonverbal behavior and like paralinguistic cues. And
I'm going to stop you there, Callum. What paralinguistic clue? What might that be?
So paralinguistic cues are aspects of verbal communication that aren't actually the meaning of the words that are being said. So there's a couple of the paralinguistic cues that we're interested in is how long it takes for people to answer a question in a kind of investigative interview setting, how long they have to think about it before they start speaking, and like the mean length of their utterances, so how long their answers are in response to in response to different kinds of questions. Also, you've got like differences in pitch as well. Sometimes some literature suggests that that's a cue to deception as well. So we're profiling these qualities of essentially what deceptive cues look like for autistic individuals. And one of the key findings from a study that Tegan is writing up at the moment, and hopefully will be submitting soon, is that averted eye gaze is just essentially a predictor of autism rather than a predictor of deception. So it's not at all useful in terms of detecting deception for autistic individuals. But yeah, we're conducting a whole suite of studies around how accurate autistic individuals are at detecting deception as well. So the idea being that due to differences in social understanding and differences in understanding mental states as well, that's a characteristic. So being able to perspective take and maybe understand the intentions of another person that would present risks of potentially being subject to fraud or manipulation or victimization along those lines. So are autistic individuals less accurate at detecting deception? And also what the label of being autistic means for neurotypical people in terms of whether are they more likely to perceive or less likely to perceive autistic individuals as deceptive when they are actually being deceptive. So yeah, we've got a whole suite of cool studies that we're conducting around this. So obviously that's a more pertinent issue for that particular subset of the autistic population, because that's a risk that they're more likely to encounter than studying how they learn vocabulary when they already have super developed language
Yeah.
skills.
Is the justice system kind of aware of this, Callum, or is this actually a problem? And there's evidence, that miscarriages of justice have been done because of autism rather than any other reason.
There are certainly plenty of anecdotal
Yeah.
reports of unfair treatment within the criminal justice system for not just autistic individuals, but neurodiverse individuals more broadly, folks with ADHD as well, for example. And we know that training for folks who work in the criminal justice system, both on the sort of the legal sort of lawyers and that's, but right down to the police, receive next to no training around neurodiversity, and or make kind of accommodations for when they encounter people who are autistic, even though the sort of prevalence of autistic and other neurodiverse individuals is actually way higher in populations that make contact with the criminal justice system in comparison to their prevalence in the general population. So it's a real area that does needs investigating, needs work in order to actually make a difference and improve outcomes for autistic folks.
Yeah, I'm still sort of blown by the deception thing of you're essentially just predicting autism more likely than you are predicting deception. That's pretty big if someone's just looking the other way. And
it's also
you're
interesting,
saying,
isn't
oh,
it,
you're guilty.
if you're doing it both ways, because if the autistic person can't pick up deception clues from somebody interviewing them over a crime, and then they don't get the deception themselves, it's almost doubling the problem, isn't it?
Yeah, no, for sure. And there's probably education to be done on both sides, really. The support for autistic folks who find themselves engaged in the criminal justice system, but also really important, educating individuals who are on the other side, who are kind of doing the investigative interviewing and so on. And really just educating in terms of, people's behavior depends on the neurodivergence, and what we stereotypically consider to be indicative of deception in one group doesn't generalize to other groups.
Yeah, and the other thing of are people who are diagnosed with autism more likely to sort of be conned and things like that? Because you touched upon it. Is this an actual thing, or is it a sort of misconception thrown around?
There's evidence, of course, that folks generally who have intellectual disabilities, who maybe rely on support, maybe there are aspects of their lives where they can't live independently, are more subject or more at risk of kind of being conned or, manipulated in some ways. And I suppose the issue, theoretically speaking, is of particular prominence for autistic individuals because we know that there are differences in what psychologists call theory of mind, which essentially boils down to being able to represent other people's mental states, understanding why they're doing the things that they're doing, and being able to spot when potentially when they're being deceived. Is there any evidence out there that really directly addresses this question? Not to my knowledge, but that's why we're doing this. That's why we're running one of these studies, because we will absolutely get the answer to that question. Because one of the studies that Tegan's running is presenting both neurotypical and autistic individuals with videos of people telling the truth versus telling lies, and we're comparing their accuracy in terms of how accurate are they at figuring out which is which, making veracity judgments. And we know that neurotypical individuals are actually really quite bad at this. They're usually about chance. And if we find that autistic individuals are significantly worse than that, then there's your evidence.
We're going to look at written deception as well. I was just thinking when Sahir was talking about scams, there's two types, isn't there? There's somebody coming up to you and talking, which I can see where the problem would be if you're autistic. How about the classic Nigerian prince email? Does that still have the same effect, or if there's a language component, do they read that and go, "That's a great idea," or is that the same as the rest of us who go, "Yeah, that's probably not going to happen"?
The phishing scam.
Yeah,
Yeah. Good old Nigerian prince. No, I can't. I'm not aware of any
yeah.
evidence that speaks to that. And again, it would vary between individuals, I
Yeah,
suspect. So yeah, it's hard for me to kind of present a clear answer to that, I think.
that's all right. Keep doing some research there, Callum.
I mean, it's a really important area that only in the last few years that we started investigating. And just this last October, we have another PhD student, Meg, who's looking at similar questions for folks who've got ADHD as well. Because again, similar story for those guys in relation to the criminal justice system, over prevalence and kind of misconceptions and increased risk. So, yeah, it's an important issue.
Well, should we move to the other end of the spectrum now and talk about your work sort of with children, sort of with language learning disabilities or difficulties?
Yeah.
Yeah. I wanted to ask, yeah, Neil had already mentioned how tough is it to actually sort of do this kind of research? What kind of stuff are you looking at in particular?
Yeah. So you've got to be very careful in how you construct the studies, because the way you design kind of experimental methods, and your selection of, say, standardized assessments. So in addition to doing whatever kind of experimental game that you want to play, it's important that you profile your sample as well. So you get a good understanding of what their language abilities are like, maybe where their nonverbal intelligence is, as well as individual differences in autistic traits, because your findings, for whatever you find, really generalize to autistic individuals that have similar characteristics as opposed to other characteristics. So for our folks, when we're working with kids who've got really profound language learning difficulties and maybe intellectual disabilities, we choose assessments that are very visual, very active, that don't rely on speech on the part of the participant to kind of generate responses. Unless we're measuring expressive vocabulary, and even then, if a child can't speak, there are measures that we can use that can gauge a child's expressive language ability from pre-linguistic kind of utterances. But lots of our studies at the moment, we've kind of developed quite a cool experimental setup where we have a huge, big touchscreen computer, and autistic kids, as many as neurotypical kids are too, they love touchscreens. And particularly for autistic individuals, there is a real preference or kind of fascination with screen-based media and often touching in that way. So we present stimuli, images, and auditory input through this screen, through this computer, and they often make responses by high-fiving the things that that we ask for. So a sort of a classic word learning study that we would do, we might present 3 images of things on the screen. And to begin with, if we were teaching them the meaning of a novel word, there are lots of different ways of doing this. But one way is setting up a situation where a child can use processes of elimination. So they can use their existing knowledge of language to figure out what a new word refers to. So you might present 3 objects on our touchscreen, and one of them is a weird, unfamiliar thing that the child has never seen before and wouldn't have a name for. Another one's a cat, and another one's a tree. And we choose familiar objects in this way to present an environment where we can be pretty sure that kids know the names of these things, because the age of acquisition is like, I don't know, 12 months to 16 months or even lower sometimes. So we can assume that the children we're working with, even though they might have profound language delay, their vocabulary is such that they're highly likely to know these words. So we would then say, which is the blicket? Touch the blicket. Show me the blicket. Now they know they don't know the meaning of the word blicket, but if they know cat, they know the cat's not the blicket. And if they know tree, they know the tree's not the blicket. So what they're doing is they're applying a lexical or linguistic assumption that one word refers to one object, and that's called mutual exclusivity. And they would correctly identify the weird, unfamiliar thing as the blicket. And what we find is that in these kinds of situations where autistic kids across the spectrum are able to use their existing knowledge of words to figure out the meanings of unfamiliar words, they're really, really good at that. So we often present new words in that way. And we might teach them, say, 4 words initially. And then we would stop for, say, 5 minutes. They play a game, maybe do some drawing or whatever. And we wait 5 minutes because that gives kids a chance to forget. Because figuring out the meaning of a word isn't learning a word. It's just disambiguating its meaning. So what we do is we wait 5 minutes. That gives them that chance to forget. And then we test their retention. Have they actually learned? Is there something in memory retained about, these associations between words and the things that they refer to? And what we're trying to do is we change that initial learning setup in various different ways to try and increase the likelihood of retention. How can we present visual and auditory stimuli in a way that helps children actually retain those associations? And sometimes we also test generalization as well. So generalization is the idea that many words in a child's vocabulary, are names for categories of things. They don't just refer to one thing. So if a child might learn the word cat in association with their family pet at home, in order to really understand the meaning of that word, they have to understand that it doesn't just refer to their black cat, it refers to the tabby cat, the ginger cat, the picture of a cat in a book, right? So, but there are certain visual constraints that determine the rules as to how we generalize words. And shape is the key one, right? That's a really important one. So we often test how we can promote shape-based generalization. So kids once they've learned the meaning of a word, they can start extending it appropriately.
That's incredibly interesting. So I'm just thinking shape-based stuff, like how you would have, and sort of orientation-based stuff, like if you show a cat upside down, is it still a cat kind of thing? Or I guess the more easier one is for like a cup or a chair, because or not easier, ambiguous one is for like a cup or a chair, right? Because in what angle is it still the same object? If you sort of are trying to categorize them in your mind.
Yeah, yeah. I mean, I'll be honest. I've not tested the ability to learn upside down cats, but in some of our studies that we use with tablets, one of my former PhD students, Lee Keating, did this. She presented images of unfamiliar objects that rotated, so they got a full 360, and that was part of the sort of experimental setup and the way we presented objects in that study.
Oh.
And is this study with neurotypical people, or are you comparing with autism?
Yeah, so that's how we do things. We always draw comparisons, and this is one of the sort of points for debate in neurodevelopmental condition research is who do you compare against? So you've got your population of autistic individuals that have delays in language. They might have co-occurring intellectual difficulties as well. Do you compare them against kids the same age? If you do, you guaranteed to know the answer to that question. The autistic kids are going to do as well because of everything else that's going on unrelated to autism.
Yeah.
So they've got these global delays in development, and that's your answer. That is why they're not doing as well. So often what we do, rather than doing that, is we compare against ability match groups. So we will recruit neurotypical kids who are often chronologically a bit younger, but are at the same stage in terms of their vocabulary development. And what that allows us to do is to identify whether there are actually any genuine differences in the way these mechanisms are functioning. Is there differences in the way that autistic kids are learning these words when expectations are based on where they're at, developmentally speaking?
What about comparing them to sort of, because we spoke about autism being a spectrum, kind of comparing sort of kids with autism showing more sort of language difficulties to sort of other difficulties? Do you sort of compare those as well to see if there's any sort of overlap in the colorway, as you had mentioned before?
So do you mean like comparing like autistic kids against kids with like developmental language disorder, or are we comparing different autistic kids against, yeah, autistic against autistic?
Oh, I now that you mentioned that, I was kind of thinking both in my mind. So one to sort of distinguish between
Yeah,
developmental language disorder versus an autistic kid with the language disorder, sort of
got
language
you.
development issues, but then also if you have a different sample of autistic kids, how does that sort
Yeah.
of manifest?
Well, one of the ideas or theories around autism is that the language learning difficulties are kind of separate in
Oh, okay.
terms that they're not, because they're not a diagnosis
Diagnostic.
defining
Yeah.
characteristic of autism. They might be their own thing, and they might have their own set of causal factors. But actually, what you find, or what we find, is that when you present stimuli in the right ways, in the favorable ways that play to the kid's strengths, autistic kids are usually just as good at learning vocabulary as neurotypical peers when
Hmm.
expectations are based on the developmental level that they're at. The one difference that we do consistently see is that autistic children are slower to process verbal and visual input. It takes them longer to generate correct responses. And on the one hand, that that's probably indicative of the kind of the global cognitive differences that are going on. That there are just general differences in the speed of processing information, and that isn't just that wouldn't just apply to linguistic stimuli. But what that suggests from a practical point of view is it highlights the importance of actually letting kids learn at their own pace and
Oh.
presenting information in a way that accommodates for those delays. And that's something that we always do in our experiments, because the kids that we work with, they do vary in terms of their attention. Sometimes they will get up, they'll run around for a bit, and then they'll kind of get that burst of energy out of their system, and then they'll sit back down and they'll play again. And that's very much reflective of how they would be in the classroom, right? So we do accommodate for children learning at their own pace. And on the one hand, that's great for us, because it shows that, yeah, these autistic kids are really capable word learners under the right conditions. But what it probably means in terms of naturalistic situations is that's a bit more problematic, because the way in which speech occurs is a lot more rapid, and there's a lot more distractions, there's a lot more noise, there's loads going on, demanding, competing demands for attention, than our lovely big touchscreen computer that is really, helping them focus. So where I'm at, theoretically speaking, at the moment, and something I want to test, is that really that's what's going on, is that in natural learning environments, kids, the input that they're receiving is different because they're paying attention to different things at different times. So their sort of multisensory experiences are fundamentally different. But when you can get them to focus, pay attention to the right things at the right times, then they're golden and it works.
So that's really the teaching strategies, I guess, that teachers need to use. It's not that they're slow or anything. They're absolutely perfectly capable of doing everything they can. They just need a slightly, either a longer processing time or a slightly different approach. And that, I guess, is something
I
that
think
is
so.
missing generally because it's a
Yeah,
busy.
yeah, yeah. And this is, of course, in we're studying individuals that indisputably do have delays in their development, but for the stage that they're at, if you
Yeah.
present information in the right way,
Hmm.
they are capable learners.
Oh, that's awesome. Uh, you mentioned, so this also, I guess, comes under it, but you mentioned a few different misconceptions, I guess, across these past 45 odd minutes. Are there any others? Well, the funny one which we laughed about was the vaccines and autism and the genetic aspects of it. But then, You also spoke about sort of gaze and sort of aversion and how that's certainly a problem in the criminal justice system. We also spoke about what we technically mean when we talk about the spectrum. Are there any other sort of misconceptions which you feel you come across when talking?
Yeah,
When you come
I
across.
suppose we've talked about not a disease. That's an important one. I suppose one that might crop up in in sort of um, in the community, I suppose, is around looking for a cure.
Hmm.
Autism, there's no cure for autism, and it isn't something that if for many individuals who are autistic themselves would say we find this concept offensive. We don't want to be cured. You know, autism makes us who we are and is special and it's an important part of our identity. Um, but to play devil's advocate, on the flip side, you have carers who are looking after autistic individuals who can't speak, who have really challenging intellectual disabilities and might engage in self-injurious behavior. You know, and for them, it's understandable why carers might very much consider autism to be a disability. So I suppose what I'm getting at is autism means different things to different people, and I think that's okay. It depends on the characteristics of an autistic individual and how it's impacting on their life. And I think it's okay for folks to disagree over this because there are I said there are lots of autistic individuals who are proud to be autistic, and it's a defining point of who they are, and they do great things educationally, professionally, um, you know. But it's important to be mindful, but that's not true, and that's not the case for all autistic individuals.
I think that's a very nice way to put it. Uh, what what was I gonna say? We often, because I do more neuroscience based research, and so when you're sort of doing animal work, you're sort of looking at the symptom, and you're only talking about the symptom. And we often have these conversations about how useful labeling something is, or labeling something as someone as autistic, or labeling someone as they have ADHD or whatever, versus the symptom, and should we be treating a symptom versus treating the condition? What is the meaning of the label? Is it like putting someone in a box versus giving them sort
And
of an empowerment by putting a name to it so that they can understand themselves better?
that's a really important question, actually, because, of course, many of the characteristics across neurodevelopmental conditions overlap, and many of them are diagnosed together. Loads of, it's quite rare that I would encounter an autistic individual who is just autistic. They would often have other diagnoses as well, whether that be ADHD or OCD or anxiety. And we know that, yeah, like characteristics of ADHD, for example, differences in executive functioning. So, kind of skills that are located in the frontal cortex, responsible for attention and time management and planning and all of that stuff. Autistic folks also often have difficulties with executive functioning. And you see some estimates in studies that up to 50% of autistic individuals also will have ADHD. So at that point, are they overlapping so much that they do represent a shared kind of population rather than necessarily being distinct? So yeah, it's a really important question around the utility of labels.
No. Awesome. Because we've been recording for about an hour now, I think we'll sort of get into wrapping up with the sort of final question. So I'll first ask Neil if he had any burning questions for Callum.
Yeah, I suppose what's the future of autism research? What are the kind of the key things that you would absolutely love to know?
Great question. In general, I think more focus needs to be on the time period of development between childhood and adulthood. I think often autism is regarded as a childhood condition because often it's identified in childhood. And then you have lots of studies working with autistic adults, university students predominantly, because they're accessible for scientists like myself. But there's that middle ground that's sort of secondary school, college, um, that is kind of neglected a little bit. And also older adults who are autistic. You almost never see research with older adults. And that, yeah, so there's a more balanced focus across the lifespan, I would say is important. Um, Adults with kind of, language, lifelong language difficulties and intellectual difficulties, they're a very underserved population as well, I would say. And also more continuing research around females who are autistic.
Mm.
Because as I said earlier in the conversation, autism is very much regarded as a male condition. We know tons about it in boys. We know how we're pretty effective at detecting it in boys, but we know comparatively little about it in females, and we're pretty rubbish in detecting it in females. So a lot more work needs to be done there to better serve autistic females.
Yeah. Um, I guess the question which I had. I know you're not a clinician. I know you're a researcher in the space, but I guess you had also mentioned that sometimes diagnosis really depends on your postcode, like the access you have um, to help or to, I guess in the UK, the NHS, but I guess the same problems would be there around the world. What sort of advice or help can you sort of indicate to people? Because you know it's a developmental disorder, you dictate it, you notice it early in life, but if you're on a wait list for a year, 2 years, that does cause that can cause a difference. So do you know of anything coming up in that regard, which is probably targeted or can help people, parents with kids who might be autistic? We don't know, but yeah.
Yeah, it's really. I mean, you preface this question with you're not a practitioner or a clinician, which
Yeah.
I'm not. So it makes me quite
Yeah.
hard. It makes it quite difficult for me to answer this question and provide advice. Um, I mean, waiting lists you can't do anything about, unfortunately. Like during that time, I suppose the best things to do is to try and present an environment that is as supportive and rich and stimulating as you can for the child, and try and take advantage of their curiosity. Try and take advantage of the things that they are interested in and use those as moments of opportunity for learning and for fostering communication. That we know that that's a strategy that some quite effective interventions employ. So if there's any scope for employing that in sort of in the home and sort of parenting, then I suppose that would be my non-expert suggestion on the practical
Yeah.
front. I mean, obviously, the research that we do, particularly regarding optimizing environmental conditions for helping language learning, we're generating scientific knowledge, and whilst we know it has utility in a practical sense, we do let the people who know their stuff employ that knowledge, right? So I have done you know like professional development seminars for like speech and language therapists, for example. I give them the knowledge. I don't tell them how to use it.
I think that's a very important distinction, and like, yeah, no, that's awesome. Because also, I guess a lot of people, like practitioners and stuff, usually don't have time to know what's happening in the latest in terms of research. It's good to sort of have that sort of
Yeah.
cross talk a little bit. Uh, awesome. So then, Callum, from you, is there any sort of final things which we didn't cover which you'd like to get across? Because yeah, you were just answering our questions.
No, I mean, I've really enjoyed answering your questions, to be honest. And, I'd just like to reiterate my thanks for having me and giving me this opportunity to speak about autism. And ultimately, the reason I do what I do is to generate knowledge that might be helpful and might be useful, and ultimately, hopefully, improve the well-being for autistic folks. Um, and I think scientists need to take every opportunity they can to do things like this, really, to not just sit in their offices and write papers, but to get out there in the world and share what they know in case anyone can benefit and help. I think it's a really important aspect of our job.
Oh, awesome. So yeah, final thoughts, Neil?
Yeah, I would just 100% reiterate what Calum said from my work of getting people like Calum to come out and talk to the general public or just talk about their research. It's so valuable and so important, not just for those of us getting the knowledge, but also for the researchers to be able to tell it through. So thank you, Calum. It's been really fascinating to sit here and listen. And thank you, Sahir, for inviting me.
Yes.
Awesome. No, thank you so much, guys, for coming on. Thank you, Calum. Thanks, Neil. Thank you, everyone, for listening. This shameless plugs of please do like, subscribe, follow, all those things. Really appreciate it. And yeah, the last question which we ask all our guests is, Calum, if you had any general piece of advice for our listeners, what would it be? It's the toughest question we ask.
Can I have a minute to think about it?
Yeah, sure.
General advice. I don't know if this is a good one. Develop good habits, I would say. I think something that served me well throughout my life is sticking to routines and holding myself accountable to those routines. So, going back into my history, as a child, I had a history of playing competitive sports and martial arts, and I developed a real sort of sense of discipline and sort of accountability through that. And I apply that to my day job, and academia is a funny one. It gives you tons of flexibility in how you go about working and when you work. But I hold myself to a routine. I go to bed at sensible times. I get up at the same time every day, and I get stuff done, and that works for me. That presents a nice work-life balance.
Awesome. No, awesome. That was great. That's great advice. All right, again, for one last time, thank you guys so much. And until the next episode, take care.